PEMF and cancer. Does PEMF have any effects on cancer? The studies that have been done show that yes, PEMF can actually reduce cancer. PEMF stands for pulse electromagnetic field, and cancer is a term for related disease, and it's characterized by the uncontrollable division of cells, and then it forms into tissues and tumors, and then they interfere with the processes of the surrounding tissue, which can lead to lethality. The thing is, although the technology is advancing, the treatments for cancer have not improved dramatically. The current treatments have a lot of side effects, low patient tolerance, and high mortality rate. So the current treatments include radiotherapy, chemotherapy, and surgery, or a combination of the three. So there is a need for alternative treatments that have less side effects, higher success rates, and higher patient tolerance. And one of those alternative treatments is PEMF. A study that has been done showing that PEMF exposure reduces cancer proliferation and the availability of cancer cells. Okay, this is in vitro and in vivo, meaning in the cell culture and a live organism. Although it does reduce the proliferation of cancer, it has the opposite effect on the fibroblasts. Okay, the fibroblasts are healthy cells, and it actually increases the proliferation of fibroblasts. That's the interesting thing, is that although it does induce the death of cancer cells and increases their senescence, it does not affect the surrounding tissue. It seems, okay, how can it kill the cancer cells and it doesn't kill the immediate cells next to it? Well, cancer cells, they have different electrical properties. They also have altered calcium and ion channels. So given those differences, you can create the targeted pulse and adjust PEMF to target only those cells. Now, the other interesting thing is that in some studies, PEMF has shown no effect on cancer. First of all, there is no consensus of a strength of a pulse, on a duration of the exposure and cancer type. There's no consensus, okay, how much the duration should be, how much of an intensity this type of cancer should be targeted with. So the variability in results because of the differences in experimental findings, and more research is being done to investigate that further. So I'm going to leave a link to multiple studies where effects of PEMF on cancer has been investigated. You can look through the studies and make conclusions for yourself.